They didn't think it was serious. It started the same way so many days start. A mild headache. A little dizziness when standing up. Someone saying, "I'm okay, it'll pass." Just another ordinary day at home. But this was before the ER visit. I've seen moments like this before. During my years as a nurse, families often noticed small changes but didn't realize what those changes were trying to tell them. Emergencies rarely begin as emergencies. They usually begin quietly, in familiar places, with symptoms that seem easy to explain away. High blood pressure doesn't announce itself. There's no alarm, no sharp pain that demands attention. It doesn't knock, it whispers. It builds slowly and silently inside the body, sometimes over years. And when the crisis finally happens, people often say the same thing: "We didn't know." But in many cases, the signs were already there. Blood pressure is simply the force of blood pushing against the arteries as the heart pumps. When that pressure stays too high for too long, it places constant stress on the body. Over time, that stress damages blood vessels and organs, especially the heart, brain, kidneys, and eyes. Hypertension is so dangerous because it allows damage to happen quietly, without causing obvious pain. Many people live with high blood pressure and feel completely normal. They go to work, care for family, cook meals, and carry on with daily life. Because they feel fine, they assume everything is fine. But feeling normal does not always mean the body is safe. What families and caregivers often miss are the subtle warning signs. A headache that feels different than usual, not just stress, not just dehydration. Lightheadedness or dizziness, especially when standing. Blurred or cloudy vision that comes and goes. A feeling of tightness in the chest that doesn't seem severe enough to mention. Shortness of breath during simple activities. Nausea without a clear reason. Sudden fatigue that feels heavier than normal. Moments of confusion, forgetfulness, or difficulty focusing. Individually, each of these symptoms can seem harmless. People explain them away as stress, aging, lack of sleep, or anxiety. But when these signs repeat, worsen, or appear together, they deserve attention. The body is often communicating long before it reaches a breaking point. In older adults, high blood pressure can appear even more subtly. The signs don't always look dramatic. Someone may seem off. Less sharp. More tired. A little slower to respond. Walking may feel less steady. Balance may seem slightly worse. Families often think this is just part of getting older. And sometimes it is, but not always. I've watched families attribute these changes to age, only to later learn that blood pressure was playing a much larger role. Hypertension reduces blood flow to the brain and organs over time, and that slow reduction can affect thinking, balance, and energy levels long before a major event occurs. This is where care before crisis becomes so important. Prevention isn't about fear. It's about awareness. It's about noticing patterns, not just isolated moments. It's about understanding what is normal for the person you care for, and paying attention when something changes. Checking blood pressure regularly at home is one of the most powerful tools families can use. Not just once, and not only when someone feels unwell, but consistently. Numbers matter, but trends matter more. A gradual rise over weeks or months tells a story that a single reading cannot. Knowing what blood pressure is normal for that individual is essential. One person's normal may not be the same as another's. Watching for symptoms alongside numbers provides a clearer picture than relying on readings alone. And most importantly, taking subtle symptoms seriously, without panic, but without dismissal, can prevent emergencies. Care before crisis also means slowing down and listening. When someone says they don't feel quite right, that deserves attention. When a symptom feels unusual, even if it's not severe, it deserves follow-up. Many crises happen not because signs weren't present, but because they were minimized. There are moments when immediate action is necessary. Medical help should be sought right away if blood pressure-related symptoms come with chest pain, difficulty breathing, sudden confusion, weakness on one side of the body, vision loss, or a severe headache that feels unfamiliar or intense. These are not wait-and-see situations. These are signals to act. Waiting, second-guessing, or hoping symptoms will pass can be dangerous. Acting early is not overreacting. It is protecting life. Many emergency room visits don't happen out of nowhere. They are the result of days, weeks, or even months of quiet warning signs. Hypertension rarely surprises the body, it warns it. The challenge is learning how to listen. High blood pressure is often silent, but silence does not mean safety. Ignoring it allows damage to continue unnoticed. Awareness, routine monitoring, and early response can change outcomes dramatically. This video is for education only and does not replace medical advice. Always follow the guidance of your healthcare provider and seek professional care when symptoms arise. If you care for an elder, support a loved one, or want to protect your own health, subscribe to Care Before Crisis. Because the most powerful care happens before the emergency, when small signs are recognized, and quiet warnings are not ignored.